to the fullest. But this is actually we need to break. Secondly, do you know what happening actually? In Pakistan, there are more than 300,000 people. It's a government estimation. We have worked together, Yasir, and you know that this is just an estimation, and you know the number is very high.
Yeah,
Actual number
yeah,
is going to be here because we have never ever done actual survey. So how we are going to get the numbers? How are we going to get the numbers? We still don't know. If you ask about my estimation, they are more than 1 or 2 millions. We can't say that they are because we haven't done the screening, so we don't know. As
yeah.
per the last IBPS, Integral Biological
So
and Behavioral
Tanzil, I'm
Survey, which
coming.
sure, Yasir, are you saying something?
Yeah, yeah. So I said, yeah, you're right. Actually, so there are so many difficulties to approaching communities. So can we? I mean, I know the they started with the AIDS Lailaj hai. I mean, I debate, I advocate about so many things many times about why we are. I mean, initially we were doing these kind of advertisement in Pakistan. AIDS Lailaj hai. There's no treatment available. There's no anything available for HIV, but there was no any prevention information. There was no any kind of treatment information, or maybe later. I mean, right now this was a negative response, and now can we transfer into positive response as well? But every time UNAIDS, I mean, just like, I mean, we were silent. We have no funding for this. I mean, come on, that the government can do these kind of things, and the government can do again for the positive response as well. Yeah, thank you so much to talk about this. And also, I love to know, I mean, it was a long journey in 87 to 2012. There was a lot of people diagnosed. There was so many outbreaks, and small cities, and there were, when they started people for the testing, you remember, in the Islamabad, every, just like, girls were positive and was positive,
Hmm,
everyone just like
hmm,
positive in the Qaeda Azam University.
hmm,
So
hmm.
stop the immediately the testing, in 2000, I think, 10. And
Yes.
then they said, no, this is a very alarming situation, everyone is going to be positive. And currently the situation is just like, because we have no any protocol of the testing, even for the childbirth, even for the dental. So now we are adopting this culture, but people are getting HIV from many ways, because we are not talking about openly about sexual health
Hmm,
and rights.
hmm.
So SR, we are not talking about sexual health. I mean, because we are conservative society, the same issues in other South Asian countries as well. So can we can we go back in 2012? How was your journey to work with the community started, and how it was? So started with the six organization. About, can you talk about these things?
Yes, yeah, Yasir. I would like to end up our last, the discussion on this alarming thing. Only 16% are on treatment. Can you imagine? Only
Yeah,
16% of positive people are on treatment, and 21 know their status. 21%. So you can imagine the situation in Pakistan. So first of all, Yasir, although Pakistan has an acceptance somehow related to the transgender, I can say tolerance, not acceptance. If
tolerance.
you have
Yes.
a transgender child, you won't going to accept it. You may let them live, but you're going not going to let them live inside your house.
Yeah.
Secondly, the other communities, even somehow you tolerate people who inject drugs, but still that is not something which you can tolerate inside houses rather than providing them the treatment. If you are talking about the other communities, the female sex workers, look at the country's economic situation, how we
Mm.
are living. It's a underdeveloped country. People are every day there is a like more percentage which is going under the line of those who can take care of them, who can carry on their burden, who can earn money, right? Per capita income I'm talking about. So as the situation is getting worse and worse,
Mm.
so more and more people are going into the sex work. And the sex work is not something in Pakistan. You can't say that like they earn a very good money, right?
Yes.
People
People will
even
consider
sell
themselves.
themselves for 100 or 200 rupees, right?
I'm talking about
uh,
50 rupees even. So 20 rupees even.
which is not even a 10% of a dollar,
Yes.
10 or 20% of a dollar.
Yeah.
So, and Yasir, there is another thing I would like to tell you. With condom, the rate is different. Without
Yeah.
condom, the rate is different, right?
Yeah.
So, this is another alarming thing. And Yasir, since, the mental health is very compromised, it's that much compromised that majority of the communities, they are taking help from the drugs. Camp sex
Yeah.
is very common. It's
I think.
so common
Yeah.
that people, all those friends which I never ever imagined are going to take that drug, are taking that drug. Those who were not even basic smokers are, I know you are raising. Yes.
Yeah, I think. Yeah. So, Tanzil, thank you so much for talking about this. So, actually, in the drugs, so I can go back with the drugs and sex work as
Hmm.
well. So, the rate is different when you're using condom. Rate is
Hmm.
different when you're not using condom, and rate is
Hmm.
different when you're using drugs. So just like 50 rupees to 200 rupees, just like boosting when you're using drugs with a partner. So, and I mean, I'm the evidence who are just like never think to do any drugs, and I was directly injecting Tina. So it was in so crystal meth. So yeah, I mean everyone knows about these things. So so how was just like my mental health was disaster, and I've been
Hmm.
through with a lot of issues. I mean, I was working in good place, and then I was done my master's in project management and collapsed immediately. So it was
Hmm.
just like so many big history, and everyone. I mean, all community-based organizations just like disown me. So there's a just like history of the work. I mean, I've been through. I know all of the things as well. So yeah, so can come back to come to you. What is going on with the so, yeah, Tanzil,
So,
I mean, how was
hmm.
your, I mean, working? I mean, I'm coming back again. I mean, we will do discuss about these
Yes, yes,
things, but I'm coming back
yes, yes.
about how was your working experience with the 2012 till
With the
2000?
community.
Yeah, with the community till 2025. I mean, still you are interconnected, but I mean, but still,
Yes,
yeah. How was your working
when
experience?
when we started working, under UNDP APRC,
Hmm.
UNDP Asia Pacific,
Regional Bangkok. Yeah.
Regional Coalition. So
Hmm.
you remember at that time it was difficult to find out educated community members, because how the model was implemented was communities should work for the communities, and it was the best
Yes.
model ever had.
Yeah. I mean, I
And
still
then
love
yes,
this
but
model, and yeah,
but
I'm doing
but
through.
Yasi, you remember people, there was so much internalized stigma and internalized phobia that even people were indulging themselves into all such behaviors and the lifestyles, and still what they were saying to others, like this is bad. So this is how we
Yeah.
identify and we diagnose internalized phobia against any kind of community.
Hmm.
Yes, you know I must recall that time, the major problem at that time, and still which we are facing, is stigma and discrimination
Yes.
from the families, from the healthcare sector, right?
Mm-hmm.
Which actually result in avoidance of testing, which
Mm-hmm.
actually result in delay in treatment.
Yeah.
All these things are actually creating a bigger problem in Pakistan. Still,
Mm-hmm. Yeah.
although these words are so common now, but we are still, fighting with them. We
Yes.
are still struggling with them. Okay? Low awareness and misconception is another big challenge. Basic knowledge about HIV treatment and prevention. Even if you go to the health sector, they don't know how they
Mm-hmm.
are going to tell to the. One of my friend in Karachi, he got exposed to HIV virus somehow.
Mm-hmm.
He was asking me where should I go. I told him to go to the civil hospital. When he went over there, the psychologist over there kept asking me, why you want post exposure prophylaxis? You need to tell me the reason. If you're not going to, he told her multiple times, right? I got needle prick, whatever the reason he wanted to give, that. And she kept asking me, if you're not going to tell me. I'm not going to give you medicine, right? I'm going to take a fingerprints, and you know that what does it mean? Are you harassing people over there?
Yeah,
What kind, what kind of treatment services they are? Are they? Can you imagine, Yasir, if something
yeah,
like this going to happen to anyone? Do you think that person will come back for the treatment? Obviously, no.
yeah. You're
We
right.
can,
Actually, I face so many challenges with the community when they're approaching an HIV buddies. It's just
Yasir,
like
Yasir, as per record, as per few of the agencies, 80% of infected individuals don't know their status, right?
mm,
Limited testing is has always been a very big problem. Still, the coverage for the HIV testing, HIV prevention services is too low. In few of the regions, we are uneven, don't even more we are unable to do work over there because of the societal
yeah.
barriers and all that, and the denial of the government that such kind of behavior does not exist over there. Can you imagine such of kind of behavior does not exist over there? Such kind of business behavior
Yeah.
does not exist in Pakistan. Secondly, if you remember that time, Pakistan was one of the country which got the highest tabs to search for the pornography and all that, but it's still but still we are a nation who like to deny it. We are still in a denial. We are still in
The
denial
not
that,
only we Pakistani, even other South Asian.
okay.
I
I
was
agree.
surprised.
Ah,
I we work South Asia. Remember, is a South Asian
mm,
or East Asian
mm,
collaboration of this a global fund project when we are reporting to
mm,
UNDP APRC Bangkok, regional
mm,
Bangkok,
mm,
and
mm,
there was so that time we don't know about these things. So when I moved into Toronto, same thing, and I was surprised when same thing is just like in South. I work for Asia, South Asia, East Asia, all work together just like same issues, conservative, hidden things. Not talking very openly. But in East Asia is better now. But still, we are South Asian communities not talking about culture barriers, religion things. We never been. Still we are suffering these issues. When not only in Pakistan, in India, Nepal, Bhutan, Bangladesh. So see the ratio of the epidemic. So the main purpose is we are talking about the epidemic increasing badly in Pakistan, Bangladesh, and another neighbor countries. So still we have no any access for the testing. Even a lot of tests we will just like in other another country who are just like full with the positive community. Just so it's a alarming situation right now. But the thing is, so the people, these are communities, straight
mm,
community or the
mm.
LGBTI community. People are thinking, oh, this is only due the root cause is LGBTI community. Then I said, but the thing is, epidemic is increasing in other heterosexuals
Alarming,
as well. Right? So
alarmingly.
the same thing the the epidemic is increasing. The HIV rates are increasing in heterosexual community. But why? Because we were focused on targeted population, and they now are understanding about the HIV, but we never target about the other communities. So heterosexual community or bridging communities as well. So right now, just like everywhere, uh, the thing is going to different. So HIV is transfusion in the heterosexual communities, and or maybe they're going for sex work, they are going for something for drug use, and also in the some provinces in the injecting drug users, same thing. And we are, I working with the different countries, I realize we are still doing in bandaging thing in some countries. We started with the community work for community, but later on we include our family and friends and nepotism, and we included other communities as well. It was not same kind of work what we were doing before, and not in Pakistan, and also in same in Canada as well. So if you're you are including your sister, your brother, your cousins, your everything. So where is the community work? So community
Actually,
works and
Yasir,
communities always come with the just like solutions, right?
We are unable to understand that this is
Yeah.
a responsibility of everybody. First of all,
Yeah.
I would say, healthcare providers, the consultants, I must say, those who knows how to control the infection.
Mm.
When you are going to walk into their, clinics and all that, the moment they are going to identify that you are HIV positive person, they will refuse to treat you. This is the current situation still in 2026, right?
Mm.
Nobody can deny that. Secondly, poor infection control, uneven, service quality of services. If you go to Karachi, different services. If you go
Mm.
to Punjab, different services. If you
Yeah.
go to KB, different services. In Balochistan, different services.
Yeah.
They all are singing different songs, right? And if somehow, if you are believing, majority of the communities, they belong to different cities, but they would like to they would like to go to the different treatment centers into different cities,
Yes.
you know forcing themselves not to get identified by the locals over there. I know
Yep.
lot of community member in Larkana traveling to
Yeah.
Karachi for the medication, just because there is a taboo, stigma, and discrimination, and fear of being diagnosed and
Yeah.
disclosed as a HIV positive person is actually killing them. Secondly, Yasir, if you ask me, right, if you ask me what are the gaps, there are a major gaps on policy level. Where is anti-discriminatory law? Sin was the first, province which came forward with the HIV bill, but
Mm.
that bill is collecting dust. It's not in place.
Yep.
Secondly, have ever heard of it? You know what we have done on the policy. What we have done is somebody is going to discriminate HIV positive person in Pakistan.
Yeah. Yeah.
Nothing, right?
Nothing.
We are doing nothing. Secondly, Yasir, look, transgender people, right? They have got somehow acceptance, but still, majority of the transgender gender person are still getting infected with HIV. Why? With other sexually transmitted infections as well. Why? If you go to, not to the major cities, to the minor cities like Sialkot, Gujarat, and all that, Yasir, my God, there was, HIV positive, HIV prevalence was more than 13-14%, right? Money is coming in, global fund is investing. That is the only donor which is working for HIV, you know that.
Yes.
HIV, TB, and malaria. And, Yasir, they have been working from so many years, right? But
Yes.
still, why the infection is increasing? Why the infection is getting? Last time when the HIV prevalence was 7.5% among the transgenders, if you go and check, Yase, it has increased up to like 10-12% in few of the cities in Sindh and Pakistan,
Yeah.
Sindh and in Punjab.
Yeah. I started
So
work. I started
they
establish organization.
nobody give a
Tanzil.
damn. Yase,
Yeah.
cam sex, nobody's working on cam sex. No
Yeah,
one
but
is
I
working.
need to include one thing. I think the 2023 I started organization, a transgender organization in Khwaja Society in Sheikhupura. So that when I started the testing of the, I mean, higher community-based organization, high community for testing and other things, it was a, I mean, just like a big thing. Sheikhupura, very conservative society about transgender, not giving your home for the transgender community. So established, so established. But when we started testing, it was just like alarming. Every 10% is going to be, I mean, positive, positive, positive. I said, I think we need to change. And there was a one quarter we had, I think, 69 or 70 positive after testing, and I said, oh no, it's just too much. I think we need to immediately we started the treatment. I said, oh my god, when just like 70 or 60 positive clients in one quarter, and one quarter was just like testing in 1 month because we had never received
Hmm.
testing kits, and my staff was, thanks, my staff were working day and night and evenings for the hotspot of the transgender. So then I realized in the small cities we have a lot of prevalence. And do you remember about my advocacy work on the chemsex since 2018, to just like fighting with the global fund, including the advocacy and working, so and national research of chemsex as well, with the UNDP. But So and also, I mean, NACP, I mean, National AIDS Control Program never wants to work on the chemsex thing, but the Global Fund pushed them, hey, include chemsex part as well. And you approach me, how can we
And
include
you are the
the
first one
chemsex?
who conducted, you are the second one who conducted a detailed research, actually research kind of a research. And Yasir, wasn't the results were horrifying? Wasn't they, all those results which you came out from after surveys in the different provinces,
Yeah,
were they not alarming? Were they not,
yeah.
alarming
71%
enough
people were
that
using different kind of drugs due
there
to
should be,
sexual control.
interventions,
Yeah,
immediate interventions and remedies for those. Yes, the another problem is, right, for injecting the users, there are rehabilitation center.
yeah,
For those who are using communities, when I'm talking about, I mean female sex workers, male sex workers, transgender person. Yasir, they have no place to go. Actually, do you know why? All those places which are actually available are very expensive and they are for everybody. So
yeah.
all kind of
I
communities,
refer
non
many
communities go over
people
there.
in
If non communities are going over
my
there, communities won't go over there. You know that they have a different needs.
no, I
So
remember.
harassment
Yeah,
kind of thing is
I
very common.
remember. Yeah, Nay Zindagi is doing great job in injecting drug users, and they said, yeah, I mean Malika Zafar said, yeah, sir, if you are looking for support, just send us your client for me. It was a really good approach with the Malika, executive director of Nay Zindagi, just like said, hey, yeah, sir, just send us. We will help them to overcome and for adherence of HIV as well treatment. So just like, I mean, people were there, but just still we need to address and advocate about work. So
Yasir, you are breaking up.
yeah, maybe some there is difficulties,
Technical faults.
technical issues, Yeah, sometimes
Yasir.
I mean in Canada even the internet is not stable.
Hmm.
Yeah, I mean let me
So
transfer
Yasir,
my. Yeah,
Yasir. So another problem is, right, Yasir. If we are working on the treatment and prevention, who is going to work on, to control this drug thing, which is like going, it's hitting everybody. It's not related to the communities. Another problem, Yasir, I would like to mention here. Yasir, why we associate HIV with communities is the
yeah,
communities have communities, oriented or generated this virus, right?
yeah.
They went somewhere on, different planet, and they brought it back to Pakistan or in this entire world. So why this is actually, related to, communities, and why this is very important. Okay, forget about the communities. I know they are traditionally being neglected in Pakistan, right? Forget about them for a moment, right? If health of others are not important, right, even for sake of others you have to do work for the communities, right? Because all those
Mhm.
people who are straight are going towards the communities and you know having sex is it not very common? Is that something, it's open secret now, we know
Yeah,
that.
might be communities are not doing enough a lot of sex, but the other communities are also doing a lot of sex, right? And randomly doing sex, and we are just like means
A good tech
attacking the
example.
thing. Just like tags, right? We're doing. I was surprised when, yeah. So, anyways, I'm not talking about these things, but let's come back on the sexualized substance use. So,
Yes.
Fazil, tell me about more. What is going on? Because in Pakistan currently, or any intervention.
Yasir, you're breaking up. I couldn't hear your question. Can you repeat, please?
Yeah, I don't know what is the issue with the internet connection today. I mean, I'm surprised it had never happened,
It's
but
okay
today it's
now.
just like
Yasir, you can
every
repeat it
time
again.
technical issues.
Please repeat your question.
Yeah,
Yeah, yes, Yasir, please repeat
no.
your
So I'm
question.
I'm more talking about. I'm more talk. No, I want to know more about what is going on with the community. I mean, what is the uh, and non-community as well. What is going on with the crystal meth? I mean, how's usage? Do you have any idea about?
Yasir, smoke is, through smoke inhalement is very common. Yeah, right. This is so common, that people are just doing it as now. I have heard few of them telling others that this is like kind of a status symbol now in Pakistan, right? Even if you are not taking a full name, right? If you are going to tell another person, do you take hash? Do you smoke? The another person is going to identify, and that person is going to understand, right, what they are talking about. Secondly, Yasir, no, nobody knows what amount of intake of ice is going to kill them, right? People
I mean, I
are
cannot say the ice is crystal meth actually. So I
yes.
mean, it was very common. Hash was very common in all communities, and like hash. And so, but
But yes,
crystal meth
Yasir,
was not
ice has
common.
replaced all of them.
Yeah, even
You know,
even
Yasir, another alarming thing is like the HIV incidences ratio is going down among the people who inject drugs.
because because they are not injecting anymore. They are
Yes,
using
they are more
using
fond of.
crystal meth
They are more
and
fond of
smoking.
ice. They are more
Yeah,
fond of ice. Yasir, with by paying like more, not $2 to $3 in Pakistan. I'm just converting the currency at the moment,
yeah,
just for the understanding. American dollar. You can get 1 gram of it, right? Easily
yeah.
by
It's so
by
cheap.
paying just $3 to $4, three
Yeah,
maximum. And Yasir, people are selling themselves to get few of the smokes at friends' place. They are okay to later. When they do that, they have no idea they are using protection or not. You know,
yeah, yeah.
unlimited sexual encounters, transmission of HIV and other diseases is fine. Yasir, this is the situation going on. Secondly, Yasir, I would like to discuss again about the HIV, alarming situation in Pakistan.
Mhm.
Yasir, the current program is not enough. The modality of current programming is not right.
Yeah.
Why we are still facing, even in the bigger cities, even focus cities where we are actually working through the community-based organization, HIV is rising. Why?
No, I was
If
fighting
we are
with
working
the
over it, why they?
initially
It
to
means there are
hire
gaps.
people who
It
knows
means
the
there are
word.
gaps. If you're
Yeah,
talking about Karachi, Yasir, among the MSM community, it was more than 13%, and it is still rising. Can you imagine 13%? You have worked in Shekhupura. I have worked in Sialkot.
yeah,
Yasir, among the transgender community is more than 13%. I'm witness by myself. I've
yeah.
seen
Mm,
people over there, right? So what is happening over there then?
yes, this
Nobody
is
has
like
ever checked. Yes.
no one
Secondly,
checked it, and
we
also in
need
the small
integrated
cities.
services. We need integrated services, and there are no integrated services. If
Yeah,
you
there is
ask
not.
them to do something regarding the chemsex, they don't have skills to do anything.
Yeah,
People,
they don't know what is they're using currently. I mean, initially it's just like, oh, what is this?
even
I
I
mean,
believe that the current management of the those who are into programming of the HIV prevention and even treatment, they don't know what they are doing actually. They are paid
you
with the
know,
staff.
Tanzil, I mean, for so many transgender community, they started. I mean, they're help. This drugs is helping you to weight loss, right?
Oh yes,
It yes.
yes.
So and it these drugs make you awake whole night. Then you can do more sex work. It give you a shape of your body. It will help you.
Really?
I mean, just like
It's
yeah,
just a
in the
myth.
transgender community, they were
It's a myth.
so famous in this thing. Let's walk it together. And when we were in the in
That's how you
MSM,
got into shape, Yasir.
I'm always in the shape, but yeah, so I was not in the shape when I was using. So so my my God. So I was just like, um, so when I start, how I started, just like, oh, this is gave you booster of you can work more, you can be more active. You can make babies with it. So just like so many things. So yeah, these. So I don't want to touch these kind of things, but these are the reality when people are
Myths
approaching
and
you.
misconceptions,
Not
actually.
not in not in the in even in Pakistan, in Canada also. If you're a newcomer, people are just like not saying you, hey, don't use it. I mean, people said, hey, let's use it, and just like forget everything. And I said, to secure yourself now anywhere is so difficult. People are just like putting like this. I mean, few days ago, I never realized my friend is using crystal meth, and he was at my home and he offered me, and I said no. And he said just like, I mean, I said, come on, people are offering. I mean, because they want other people as well to just like join them and pay money, and also they give you shelter, they give you, I mean, food, and also people want to misuse you. So it's everything everywhere. But the thing is, I always give the example of Vietnam. They are doing great work in chemsex and sexualized substance use. They were doing in a PEPFAR funding, but now I do not talk with them. They were doing a great job, but now they are getting funding from other, and the government is so supportive to help to work on the. I mean, I met with the public health of Vietnam in Australia, and she was said, just when she was talking with tongue, and I said, just tell me what I have to do with the community. I love to do something. I mean, in Pakistan and India, I mean, community say, oh, go to hell. Why you're useless because you're a drug user? Come on, we are just like, I mean, there are so many people who are very educated, very they did a lot of work. Like, I mean, I did a lot of work in the previously before using. So I in the before and then after they, I mean, once they are been through with this, they are doing a great job as well. So why not we can help them with them. We have a lot of work in Canada to especially dealing with the crystal meth. But what is going on in Pakistan, even increasing of the in the $64 million to $74 million, $10 million increment in 2021 of the work on H and the crystal meth. What happened after my research? They just relaunch they just launch a prep.
Hmm.
That's it. I mean, after
Hmm.
been what when I suggest them to just like approach with the community outreach, but they, I mean, no one work on it. So
Yasir,
there was a
you know
guidelines to
why PrEP
approach on.
got failed into Pakistan? The reason is there was nothing like a need assessment before
Yeah,
launching it. Secondly, those who conducted research earlier regarding PrEP, the number was too low. 50 is not a number actually which can represent the entire communities. And secondly, Yasir,
no, I did
the
a need
awareness,
assessment and I included prep
awareness
as well, and I
raising
said,
campaigns, Yasir, awareness raising campaigns were not there. When you are unable to create a demand for something,
yeah,
why somebody would like to take it, right? People won't in here in Pakistan, people don't even like to take medication for their such kind of sickness, a normal common sickness,
it can be.
flu and temperature and all that. How they are going to take something for no reason, actually?
Tanzil, I love to share one issue
Hmm.
currently. I mean, in
Hmm.
Punjab, people in the positive community is approaching me because the Punjab AIDS control program forcing them to start prep of their partners. And I said, why they need to start the prep of your partner and use once you're undetectable, you don't have to. I mean, your partner should not have to start prep because you already undetectable. You're continuously using treatment, and I mean, this is a proof that we have a lot of researchers, but they are
This is
forcing them to
unethical,
use
Yasir.
prep because they need to achieve the targets.
But Dasi, Yasir, this is unethical. If you're
Yes, it's
forcing
very
somebody
unethical,
to
and
do it.
people. I said, I talked with few days ago the ex staff for Punjab AIDS Control Program, and he said, "Yeah, sir, I am trying to do these kind of things, but they are not doing." So I was thinking to just like approach. Then I said, it's too much work again for me, and but I love to do it. But the thing is still, I mean, now they have to manage their self. I'm not living in Pakistan, but still, I mean, every time they are pushing me to, hey, can you please? I mean,
Yasser,
there's
another
no
thing
one who
came
can
into my
help them.
mind. Yes, exactly. Yasser, another thing came into my mind. You know why the programs are not very successful? Because we are not developing more community organizations, right?
Yeah,
First of all. Secondly, community is not being engaged into the programming and the management of the community work, right?
yeah,
So this is the another disaster which is happening, right? And this is proven evident that communities work for best for the communities. Then why communities are being neglected when
yeah.
they are talking about their prevention and their treatment services? First of all.
Hmm.
Secondly, Yasir, look at the legal situation. Look at the community overall situation.
Yeah.
Now people, even community has more awareness, but still infection is increasing
Yes.
because Yasir, ultimately they have to go at the same treatment centers where people are not willing to work for the communities,
Yes.
right?
They hate people.
If you walk into my clinic and I'm going to tell you that your lifestyle, everything is illegal. Such kind
Yeah.
of word I'm going to pass on to you, Yasir. You won't come back to me again, right?
Yeah.
Doesn't matter you are educated or you are uneducated, Yasir.
Yeah.
There is a large number of community members. They prefer to go to the private clinics. They prefer to
Yeah.
go to the hospitals where they won't be judged. First
Yeah,
of all,
like I mean, they are getting treatment Al Khan better than other clinics in
exactly,
Pakistan, and also in
exactly.
the Shaukat Khanam they are getting more better treatment because they are paying 2,000 rupees for the doctor fees,
Hmm,
but they are not comfortable to go the government hospitals. I
hmm,
mean, I remember I faced so many challenges, and I'll always just like talking with the Punjabis program. Hey, we have these complaints, we have these issues with the positive community, how they can go for the treatment. And especially in the COVID time when no one wants to work for the community. And
hmm,
thanks to APL-HIV, and also our leaders who came out and worked for, hey, we can bring these treatment for the doorstep of the community.
hmm,
Though, so it was a very achievement of our community, but still we have no one voice on the work and issues of HIV. We love to work for community only for money, but not for work for the community work, right? We
exactly.
love to work to getting money from, when there are many people who are doing in United Nations Development Program, they don't know anything. I was surprised when they hired me. Even I said, they
And
don't know
often the
anything,
case.
and how you guys are hiring them for people who are already marginalized, living with HIV. You don't know about the HIV abbreviation even, but you started with the program of, thing. It's just like I was surprised, and I fight for it, but it was useless. So I said, I think this is not time to talk about do whatever. So what has happened after 2021 to 2020 means still just like increasing, because we have no proper check and balance. We have no proper monitoring and evaluation. Do you remember how much we did in the monitoring and evaluation, all program evaluation, all training of staff, whenever we were in community based organizations. We were
Hmm,
talking about interviews. We were talked about, hey,
hmm,
interviewed me. Do pre-counseling and post-counseling with me, and I will help you to improve your quality of testing and pre-counseling as well. Because I've been through with these things, so I know about these things as well. So might be it will help for other communities as well. But now, just like, do whatever he wants to do.
Yasir, the
In even the
another.
hiring process. So if
Hmm,
they
hmm.
hire their friends or family, we were just like, I said, no, this money will should go to community who are living with
Yasir,
HIV or
Yasir, if you
whoever is for
have a
the
look, what
HIV.
is happening actually, the major chunk of the money and the donation of the global fund is going into just into the management of this
Yeah.
program.
Yes.
The end user is not getting anything, right? Secondly, Yasir, the program is so compromised. Even Yasir, they can do a lot better. But the thing is like there are a lot of things which they are doing which are unnecessary at the moment, and lot of things which are necessary are not actually happening in Pakistan.
Yeah.
Secondly, Yasir, when we are going to have a one-stop shop, there are gaps, there are delays in treatment, there are gaps into getting medication. The system is so complicated, right? If you are going, Yasir, if you are going to put me all through gaps and situations, I would prefer, I would avoid to take medication.
Yeah.
That's what which is happening. What kind of support is there? There are no peer groups I have ever seen, right? There is nothing which require a focus is being focused. There is nothing like that. Secondly, Yasir, don't we have educated community members? They can lead a lead. They can take a lead. Why? We are not giving them the chances actually in
Yes.
Pakistan. Secondly, few of the communities they deliberately want not to get managed by the other community members, all the communities, because they know that there will be a proper monitoring and evaluation system, right? And Yasir, there is a lot of corruption in this funding happening at every level, I must say. So this is one of the another question mark on those who
Yeah.
are actually managing it, right? Their surveillance is too low. So this has been unfortunately we are so unlucky in this under this situation. And Yasir, we don't work to get independence from the funding situation.
Mm.
We never work for self-resilient program.
Yeah.
We don't want to get dependent on ourselves. First of all, we always need a dependency.
Yeah.
That's how we work. We never talk about having an integrated one-stop shop for the communities where they can get services at one place.
Yeah.
They have to go to the different places. Nowadays, right? Few of them were telling me, right, for CD4, if you feel like, then you can have a CD4, test. Otherwise, you don't have to. CD4 count is not easily available. Once in a year, right?
Yeah.
Even it is a need based, right? If you look deteriorated, then they are going to do it. Otherwise, it's not needed, because they don't want to put money in all that, right? I have seen by
But the
myself.
WHO guidelines said you have to go with the twice in a
Yasir,
year,
Yasir,
and
in Pim's hospital, I have seen by myself all positive people making a queue for the CD4 test. More than 20 were over there. Women carrying children, they were
CD4
also
viral load
positive.
both.
Adults, men, they all know that they all are positive.
Yeah. Yeah.
And
In the same in the
people
Jinnah
who were
hospital as
passing
well.
by, they also knew that they are positive. So where is the
Yeah.
confidentiality then? Yasir, do you think one positive person should know about another positive person?
No.
Where
So
was the confidentiality then? Thank
yeah.
God, few of the physicians have left, but this was actually happening. I have seen this is one of the prestigious health institution. I have seen by myself.
Yeah. I mean,
So where was the
not in a
confidentiality?
PPMs even Tanzil, in the Jinnah Hospital Lahore as well, and also in the same time in the time of Punjab AIDS Control Program doing their own testing as well. So they were just like people are sitting for a long time, and there was a person is not available for the who will do testing. There's people waiting for so. They are sitting for 11 a.m. to 2
Yasir, you
p.m.
remember when they were conducting a test in GC University, right? There
Yeah, I
was no
know.
confidentiality. There was no
Yeah, there was no
right? They were saying
confidentiality.
like go through the volunteer testing of Hep C and
Yeah,
HIV, and there was no confidentiality.
yeah. So it was. I
That was
was
an open
surprised.
place.
We are very okay with the Hep C. We love. People are. They're very general. People are getting
It's
HC.
normalized.
It's just like normalized. But why we with the same transfusion, same other things, and
Same.
but we
Yes.
never talk about HCV.
We are
But we always
normalizing,
talk about
like if
having
somebody
with
is
the
HIV positive,
HIV.
we are normalizing it. Hmm. Hmm.
Yeah, you're not normal because you're not human. We don't have to sit with you, and we don't have to talk with you. Don't have to live with you. It's
Actually,
just like taboo.
Yasser, even in 2026, I came to the conclusion that HIV is a disease of communities only. it has nothing to do with other non-communities and other people. Secondly, they are the only one, they are spreading it, right? And what we are doing with the migrant workers, what we are
Yeah.
doing with the prisoners, have they being tested? Lots of prisoners have got positive inside under the control. So this has also happened multiple
Tanzil,
times. There is
yeah.
no
So
prevention going on. Yeah, say there
can
is
I
no prevention.
I can share you one thing. So I'm living in Toronto. I'm working in Toronto, working for Canada, for
So you're
South
not,
Asian community in MENA.
you
So
don't have any.
no, no, no. So here, people also, when they are coming from villages on side of the even so not rural areas, so they don't know about HIV, and also they know about HIV, but they don't know about U equals to U. Same in Pakistan, and also undetectable. So few days ago, my when because now HIBud is going to be in corporation. So we were talking about we can change the name, not the don't, who are board member. They said, can we change the name of HI buddies to community buddies? I said, why? I have a long, this HI buddies has a long journey to work for the community. They said we are not comfortable to link with the HIV. We are comfortable to just like community buddies will be helpful. So then we can do these kind of things, and HIV is very specific for this. And I was silent. I said, how can what can I say about this? A lot of work, a lot of things already established, and everything is, working with UN, working with UNODC, with the UNAIDS, just like our international partners. So do I need to do all things again with just like, we just relaunch, rebranding, and but still
It's
we
like
have a
redoing
lot of
the
taboos
same work
with
again,
HIV because
and the years and years of effort would have been wasted if you do that. Yeah,
yeah,
so
it's not wasted, but the thing is, the name is going to be changed, just like Maput to Saput. It's just like, okay, I can change it, same thing, but the thing is, then what? The same thing, we are already working for sexual health. We are working for hepatitis C. We are working for HIV. But they said we will work under community umbrella, so it's fine. But still, can you think about it? 2026 people are talking about this because they are migrant from other countries. They are still in the same culture. They are still not accepting HIV. They are still, their taboo and stigma and discrimination is super high. People, and all of them, you're brown. We are brown, right? So when you're brown, people don't like brown community in these
really,
countries. Yeah, and
even
also
even those who have systems and law
very
and order.
established system of anti-hatism, but and but still, and Islamophobia. And Islamophobia is super high in the world,
Oh,
and Pakistan is just in the Canada is just like Islamophobia as well. And also just like all things together, it's just like I said, oh my god, it's so much things to do. Yeah, so we have just 4 minutes left, Tanzil. So can you add something what it will be helpful for the community? Any
Yasir,
message?
Yasir, I want to add that it's not very pleasant. The thing is, I must mention and talk about facts and figures that if we really want to control the disaster of HIV, I must say we need to work towards ending it. We must conquer
Yeah,
it by dealing with the stigma discrimination, and most of the stigma and discrimination is unfortunately after the families is coming from the health sector.
I think you're
Secondly,
talking about solution oriented rather than bandage
yes,
oriented,
that's
not
it. And
using
secondly,
bandage.
we need to have a strict anti-discriminatory law towards the to protect the HIV positive person and their respect and dignity among the society. And we must focus on the mass media as well. How we can create more acceptance. We don't need just tolerance. We need
Yeah,
actually acceptance that
yeah.
they are happily living with their loved ones.
Yes,
And
yes,
Kase, apart from that, there is a special need on the community work. The quality seems very compromised,
yeah,
and Yasir, the another thing is like Still, I would like to repeat my words, like those who are managing all these funds should think about, engaging the community into the, leadership role, and, the managerial role. And secondly, it's not always about, funds and finances. And we need to think about how we can create an enabling environment, right,
Yeah,
where we, even after work, continuous work of 14 to 16 years, for the communities, still people are dying with HIV. Still
yeah, you're right,
people
Tanzil.
dying with, the new disaster of camp sex. Still
Yeah,
people are by, fear. Still we don't have a peer support groups in Pakistan.
yeah,
If you got diagnosed with HIV, where would you like to go? Who is going to help you? There is no place to go.
yeah,
Still, people are facing all such situations here. So what we have done for them is is only
yeah,
testing and
nothing.
screening
So,
of
but we're
HIV
trying
in the
our
major cities
part.
of Pakistan is enough.
Yes, and treatment.
Hmm.
You just like
So yes, this is the
treatment.
situation. If we are not going to think
There's
about
no
all these,
leadership.
hmm,
There's no empowerment.
hmm.
There's
So yes,
no
there is a serious healthcare
visibility.
gaps.
Visibility.
There are serious healthcare gaps in
Yeah,
Pakistan.
yeah,
Coverage is very low. For example, if 100 community members need services, we have only funding for 13 to 14.
yeah.
Coverage is very
Thank
low. Oh, for
Thank
all
you
the
so much,
communities.
Tanzil. I mean, I love to continue
Have
with
a
you
great day.
because there's a lot of information. You can stay. We will talk for 5 minutes more, and but I need to close the streaming. And thank you so much, Tanzil, to give us the time to know more about the current situation in Pakistan and the same situation in the other countries or neighbor countries as well. But we are still suffering. We are very much depending on global fund funding. It's extended till 2000. It's 29, but what next? Still, there is a question mark. So what next? When in Canada we are cruising as well for the HIV, but AIDS is done, but still we have issue with the stigma and discrimination and HIV. There is no cure. So until cure, we will face these problems, their diagnosizations, their problems. So thank you so much, Tanzil. I hope so.
Thank
We will keep in touch again, and thank you so much who joined us for this call, and thank you so much first of all Masood, Farid, Malik as well, who are very close to my heart, who work a lot in UNAIDS for including the communities as well. Thank you so much, Tanzil,
you.
and
Thank you.